I've been a dentist 19 years, and I remember in my first job, look, I was struggling to identify when to intervene when it comes to decay. In situations where it's a large amount of decay, it's very, very easy. You don't even need AI. But unfortunately, the prognosis of the filling, the outlook for the filling, many times is not as good as we would like because it's pretty large, right? It's quite difficult to identify decay in its early stages and intervene appropriately. Because if you intervene early enough, the prognosis of that filling is actually really good.
So 2 weeks ago we have got a new system in our practice which is called Overjet AI, and it interprets X-rays. So I'm going to interview Ope to tell us why is this so important and how it helps us to identify certain disease.
So this is a long-standing patient of the practice, and you look at this set of X-rays. Before AI, we could look at them, and they're just different shades of grey. Okay, you and I have been trained to look at them, but sometimes it is very, very difficult to tell: is this decay, or is this something to do with the film? So this X-ray of the lower left, anybody looking at this X-ray can easily see that there's a massive dark area here, right? Confirms. In this case, it is very easy. You can see it, you don't even need AI. But let's see what AI has to say. AI also confirms there's a massive hole in this particular tooth, and also early decay in the tooth behind. Bottom line is, if we're going to do a filling on this, if we need to restore this tooth, if we're going to keep this tooth, you have to do a surgical procedure, you have to do a root canal, and then you do a crown. That's a lot of work to try and save the tooth. But if it was possible to spot this decay a year before this X-ray, this red area would be a lot smaller. So here we go. This is the top right part of the mouth. The AI is immediately telling me that this yellow spot is early decay, but it's very, very early decay, and maybe I have to decide, or we have to decide, is it worth filling, is it not worth filling? But anything that appears blue like this, again, is an old filling. But you can already see that. These are old fillings, and the AI has picked it out. So now we are on the top left side. Again, 2 yellow spots. You can ignore this big yellow spot. That indicates it's an abscess, but this is where our clinical training has to come into its own, because although AI is very, very good, it is a tool and does get things wrong. It says it's a large abscess here, but I'm absolutely certain that it's the sinus that is just getting a little bit confused by. But we look on the lower right side. When it appears red like this in Overjet colors, that means that there is decay. Remember, it was red on the lower left, but the same tooth on the lower right, there's a red area of decay. And if I hide that, and I have a look, and I hide that, and I have a look, this is when we want to intervene and do the filling. But I cannot guarantee, and you cannot guarantee, and no dentist can guarantee that they would be able to see that lesion 100% of the time. And it is here that we want to be doing the filling. But with Overjet AI, very, very easy. It's pointed it out. It's an Ope Flori, this is decay. It's red, so I recommend the filling. But again, this is relatively new technology, and we're very fortunate to have it here. But like I said to you before, yes, it's a tool, but we also must use our brain and satisfy ourselves that it is doing what we actually want it to do. In other words, it's picking up decay when there is decay, and not picking up decay when there is no decay. So this is the lower right, this is that tooth. So what I've done is I've drilled a hole into that decay here, and here we have it. And obviously, clinicians like ourselves know that that's what decay looks like. Yeah. That's exactly what decay looks like in reality. It has already spread into the dentin, and that is when to treat the decay. When it's gone through the enamel and has started going through the dentin. Now, very, very quickly, I was then able to do the filling, and everything was fine. Now, let's look at the upper left side. One of the things that we don't want to do is intervene too early. Here I wanted to make sure that that was the last element of that he ever had. He's not. So we're looking here and we're thinking, do we? Do we not? Do we? It's very, very small. Okay? So I decided to go in and drill it. I took out all the decay in this particular tooth. So this tooth here is this one, okay? And then this tooth here is this one. I forgot to take out take a picture that demonstrates the decay. And again, there was decay that required filling. And to be honest with you, without Overjet AI, now because the AI has pointed it out, but before Overjet AI, I wouldn't, you know this, neither one of us would have seen that. But Overjet AI showed us that there was something in there, and we went in clinically. We ended up doing the filling. It is so satisfying, at least for me, and therefore you and everybody in our team, that problem that has dogged me and all my colleagues is finally solved, which is brilliant. And in my view, we cannot say that we are a prevention of dental disease practice without a fantastic tool. And frankly, none of them has got me this excited, primarily because this tool is really prevention and prevention.